Okay, potassium channel opener. So we'll talk about minoxidil and there is diazifoxide. So these are what potassium channel openers. These were used earlier to treat what severe hypertension and hypertensive emergencies. So the newer drug which was recently introduced in 1990s is what is Nicorandil. So this is used as an alternative to which drugs, nitrates and calcium channel blockers. What does multiple types of potassium channels will regulate movement of what ion across the cell membrane? Of course, potassium ion, and this specifically Nicorandil opens which type of potassium channels? ATP sensitive potassium channels. We'll talk about Nicorandil in detail. So it has a dual mechanism. It is an anti-angina drug which activates ATP sensitive potassium channels in which muscles? In smooth muscle membranes. So smooth muscles are usually your blood vessels, and once they are activated, potassium goes outside, and what is going to happen? There is hyperpolarization, and that leads to what action of the muscle? Contraction or relaxation? Relaxation. So the vasodilator action is partially antagonized by what? So if you are on what drug, this action can be antagonized if you are on a potassium channel blocker. Example of that, glibenclamide. So if you are comparing Nicorandil and nitrates, what is the similarity? They both act as a nitric oxide donor and they are going to relax the blood vessels. How? By increasing the cyclic GMP. So there is arterial dilation coupled with venodilation. So both arterial and venous dilation is happening with Nicorandil. So what is happening? Both preload and afterload are reduced. Coronary flow, what happens to coronary flow? Coronary flow increases. What happens to contractility? There is no significant effect on contractility. What happens to conduction? Conduction is also not changed. What are the beneficial effects on angina frequency? So the beneficial effects are on angina frequency and also exercise tolerance comparable to nitrates and calcium channel blockers have been obtained in stable as well as vasospastic angina. So how is Nicorandil believed to exert cardioprotective action? It is believed to exert cardioprotective action by stimulating ischemic preconditioning. How? By activation of mitochondrial potassium ATP channels. Ischemic preconditioning is what? It is a phenomena in which brief periods of ischemia and reperfusion exert a cardioprotective effect on subsequent total vascular occlusion and involves opening of mitochondrial potassium channels. And then you have to talk about a study, a large impact of Nicorandil in angina, IONA 2002. It randomized trial found Nicorandil to reduce acute coronary events in high risk angina patients. So Nicorandil is well absorbed, so you can give it orally, yes, but IV is also available. It is well absorbed. Where is it metabolized? It is metabolized in liver. How is it excreted? It is excreted in urine. It exhibits which kind of elimination? It shows a biphasic elimination. So the initial rapid phase, T half will be 1 hour, and later phase T half is how much? Is 12 hours. What are the side effects of Nicorandil? Because it causes vasodilation, it can cause flushing, palpitations, weakness, headache, dizziness, nausea, vomiting. There can be painful large aphthous ulcers in mouth. How are they going to heal? They are going to heal on stopping Nicorandil. And then nitrates like tolerance does not occur with Nicorandil, but it has the potential to interact with which kind of nitrate? Sildenafil. What are the doses that are available? How much dose would you prescribe your patient? 5 to 20 mg BD can be given. Tablets are available in which grams? 5 mg, 10 mg tablets are available, and vial can be 2 mg per vial or 48 mg per vial is also available. So is it first line treatment for angina or anti-angina? No, it's a second line treatment for as an anti-angina drug whose efficacy and long-term effects are less well established, so it has failed to acquire wide acceptance but may be useful in resistant angina when compared with other drugs. Administered IV during angioplasty for what? For acute MI, it is claimed to improve outcome.